CNA Rhonchi Lung Prep Quiz. Question 1. What is the purpose of a sandbag? The answer is to immobilize a limb. Sandbags are heavy fabric bags filled with sand used to immobilize a limb or body part after surgery or injury. They provide gentle pressure and restriction of movement without being a restraint. They are placed alongside the leg or arm, not for exercise or propping pillows. The correct answer is to immobilize a limb. Question 2. How do you properly position a resident for oral care if they are conscious? The answer is semi-Fowlers. A conscious resident should be placed in semi-Fowlers or upright position for oral care. This allows them to spit effectively and prevents choking and aspiration. Lying flat forces saliva to pool in the back of the throat. Prone is on stomach and impossible for oral care. Trendelenburg head down is dangerous. The correct answer is semi-Fowlers. Question 3. How often should you offer toileting to a resident on a bowel training program? The answer is once per shift. Bowel training programs aim to establish a predictable pattern of elimination. Offering toileting every 2 hours mimics normal bathroom habits and helps retrain the brain and bowel every 30 minutes is excessive and disruptive. Once per shift is too infrequent. Waiting for requests often fails because residents may not feel the urge until it is too late. How many did you score out of 3? Visit our website at pokerexams.com to get full, in-depth test banks to help you prepare and pass your exam. If you enjoyed this video, like and comment on the topic I should post next, and don't forget to subscribe. Bye.